So after a miscarriage, a lot of times, as I mentioned, patients just want to go flying right into their next cycle. They don't want to think about it. They don't want to spend too much time dwelling or grieving on about what already took place. But it does take a little bit of time. And obviously, depending on how far along into the pregnancy they are, the amount of time it takes is going to be different. So these are my own guidelines and recommendations. They may not necessarily dovetail with the patient's desire or with the clinic's recommendations. This is really a holistic perspective. And so keep in mind that you are going to need to adjust it. So if somebody has a biochemical pregnancy, I pretty much say, let's work on this for the remainder of the cycle. You can try again next month if you want to, but let's do some concentrated work around any emotional trauma that came from losing a pregnancy at this early stage. If they are around 7 to 8 weeks gestation, I would say that you want to have them wait the remainder of that cycle. So what does that mean? Like they're going to have a miscarriage, they're going to bleed. It's probably going to take a good 4 to 6 weeks for them to get another menstrual period and then wait one more. For 9 to 12, we're looking at a remainder of about 2 cycles after that first miscarriage cycle. And later than 12, particularly if there's a stillbirth, if you're in the 23, 24, 25 week range, which is really a deep tragedy for patients, then you're looking at the remainder plus an additional 3 cycles. A lot of times it just works out this way because whatever thing caused a miscarriage, especially a later miscarriage, takes time to resolve, whether that means there has to be a D&C and that needs to heal, or we're waiting for lab results to see what the reason for the miscarriage was, or whatever the reason may be. A lot of times this just kind of unfolds naturally. I think what's important is just talking to patients about really getting themselves into that same 0 trimester mindset that we had them get into before this happened. And it can take a little bit of time to get back to that place of like, everybody kind of reacts differently, but a very common way we react to tragedy is by like throwing the healthy food out the window and going and drinking a bunch of wine and whatever, deciding to go and do that boot camp class 10 times because you're sacrificing for this whole thing. All that's valid and it should be encouraged. Get it out. Do what you need to do. Take a break, but don't take a break and try at the same time. Take a real break, heal. It's physically, mentally, emotionally, and then get ready to start again. Now, again, these are guidelines. So if your patient's 43, you may not have the benefit of that kind of time to spend, but it's just something to kind of use as a benchmark and to really think about how we're going to help people get through this in a more comprehensive way, rather than just like, well, that's over, I'm going to move on and do it again. So ways that we can support miscarriage recovery: inviting our patients to consider the shift that their body had to undergo, and for the duration of time that they were pregnant, to give themselves a similar amount of time to recover. Recommend that they carve out that time, that it's not this sort of ephemeral notion, but actually slowing down in the same way that we talked about slowing down when you're getting ready to become pregnant in the first place. Or, in my postpartum class, we talk about so much the importance of the first 40 days or so really slowing down. And so, that's roughly the amount of time it will usually take somebody who's had a pregnancy loss to get another period as well. So I think the body is really asking for that slower kind of functioning and recovery for that period of time, and really honoring it as like, I'm recovering from something that happened to my body that needs to heal. Give them permission to grieve as well, even if the loss was very early. Talk about the grief. Tell them, it's normal to feel like you lost a baby, even though the embryo never implanted. Give them permission to have those feelings. Focus them on helping them to keep warm in the same way you would with any postpartum patient. Help them to replete lost blood with, nutrients, with moxa, with herbs, with the food that you're recommending, similar dietary strategies to a postpartum, especially at the beginning, especially during the time of bleeding. I like to kind of frame it in the context of they're laying a new foundation of fertilizer. They're preparing the soil for the next pregnancy. So we're not going to rush. We don't want to be using the old soil. We want to completely get it out, and we want it to be replaced and vibrant and healthy and strong. And really listening to them for the signs of self-blame and guilt and anger, and support them with therapists, with support groups, with your own recommendations, or however you're trying to support your patients in that way, because that's insidious. When they start blaming themselves, feeling guilty, feeling like they did something wrong, directing anger at themselves or at their partners, then we're starting to get into a place where things can really start to go sideways for them in their relationships and in their, in this whole process. So listen for that, pay attention to that, make sure they understand it is not their fault. No matter how it went down, it is not their fault.